Hey guys, today we're going to be talking about esophagus gastroduodenopathy. So I wrote the whole lecture out on the board and I was going to record it the other way, but it didn't work out. So I'm just going to talk from the back of the camera. Basically what the word means is that it's bleeding from the stomach. I drew kind of a poor picture up on the board, kind of labeled where things are in the stomach. You have the anterior surface and then you have the esophagus. So basically the word means, if you kind of break it down, esophagus, so you all know where that is, gastro, stomach, and then pathy, so disease and bleeding. So basically it means bleeding from your stomach. And essentially it's caused by cirrhosis of the liver. You can have different kinds of ulcers in the esophagus and the stomach. It can be caused by a number of different things. If you take a lot of NSAIDs, it can cause bleeding. Alcohol, tobacco use, basically toxins, overdose. So I just put the main cause up there, which is cirrhosis. You can also have some of the symptoms or complications would be esophageal varices when you have excessive amount of bleeding from your esophagus. It's a medical emergency. Some of your nursing diagnosis for this would be risk for bleeding. Of course, if you pop an ulcer, anxiety from the internal bleeding that you never know when it's going to happen, acute and chronic pain, like it's painful when you have blood coming up continuously and you don't know what's going on and you're in pain from the ulcers. A diagnosis for this would be an endoscopy or a fiber optic camera. They can go down there, they can drop a camera, they can see what's going on in your esophagus and your stomach. This you would be NPO for a couple of days. It would be an outpatient procedure. You go home that same day. They could have different types of pain management for you when this is happening. Basically, the doctor's going to look and see what's going on and then begin a course of treatment for you. So some of your nursing interventions would be pain management, making sure their vital signs are all right, making sure you record their eyes and nose, and different kind of medications, especially if they're on something like Coumadin or a blood thinner. Make sure they stop treatment of that. For your treatment, beta blockers is a big one. It helps treat actually esophageal varices, which is something that I found. And then for your nursing interventions, obviously you're going to help with their pain. You're going to make sure they're comfortable. And then do patient education on what essentially they could do to prevent this from happening in the future, and then their quality of life after this has happened. There we go.